Hi everyone, this is Dr Eyetemou Miguel, your pharmacist. In this new video, we are going to talk about athlete's foot. We are going to see why it is called athlete's foot. We are going to see the causes, the symptoms, how you can recognize it, also the treatments, and we end the video with 10 secrets for you on how to prevent athlete's foot. So let's talk about athlete's foot. What is athlete's foot? It's a fungal infection of your skin or the nails of your feet, and it is commonly seen in athletes. This is why it is called athlete's foot. Athlete's foot is caused by fungi. The name of that fungi is Tinea pedis. You can get infected through an infected person, through contact with an infected person, or through contact of your feet with a contaminated surface. Tinea pedis is mostly found in places that are warm and moist. So warm and moist environments such as damp shoes or damp socks, in the showers, in locker room floors, or even in swimming pools. So these are places where you will be more susceptible to get the infection. What are the risk factors for getting Tinea pedis, for getting athlete's foot? One of these factors is going barefoot into those public areas that are just cited. And the other factor is sharing items with an infected person. So if you share, for example, your shower towel with an infected person, you might get infected. Or if you share your shoe or your socks with an infected person, that will increase your risk of developing the infection. Also, wearing tight shoes is one of the risk factors. If you have an injury on your skin or on one of your nails on your feet, that can increase your risk of getting athlete's foot. If you keep your feet for a long period of time in contact with water, because as we have seen, fungi like moist environments. If you have sweaty feet, so if your feet sweat a lot, that might increase your risk of developing athlete's foot. And also you have conditions such as diabetes and immunodeficiency. So what are the symptoms of athlete's foot? The symptoms are mainly visible between your toes or on the soles of your feet, and you will experience symptoms such as itching, stinging, or burning sensation. You might have blisters, cracking or peeling skin on your feet. You might have a dry skin either on the side of your feet or on the soles of your feet. You might also have on your toenails discolored toenails or crumbly toenails, and also you might have your toenails that pull away from your nail bed. So these are some of the main symptoms of athlete's foot. Now, how is it treated? It is treated through three main families of medications: antifungals, antibiotics, and anti-inflammatories. Antifungals are medicines that are going to fight off the development or to limit the proliferation of fungi or even to kill them. And in this family of drugs, you have clotrimazole, fluconazole, and terbinafine. Doctor may also prescribe you some antibiotics which are going to prevent further infection of your feet by bacteria. And also you might also be prescribed anti-inflammatories to reduce the inflammation on the site of the infection. Now let's talk about how to prevent athlete's foot. We are going to see now and end the video with 10 secrets, 10 steps for you to take to prevent athlete's foot. Number one, you have to wash your feet every day with, if possible, warm water and soap, and make sure that you dry them thoroughly, especially between your toes. Number two, you have to wash your socks, your beddings, and your towels on a regular basis at temperatures of at least 60 Celsius degree. Number three, you have to put antifungal powders on your feet on a regular basis. Number four, you should avoid sharing your personal items, your towel, your shoes, or your socks with other persons because they might be infected and they might also infect you. Number five, you have to protect yourself in public areas such as swimming pools by not walking barefoot but by walking with sandals. Number six, wear socks and shoes that are made up of breathable fibers such as cotton or wool or synthetic fiber that will draw moisture away from your skin and from your toes. Number 7, when you feel that you are sweating too much in your feet, you need to change your socks as soon as possible. Number 8, give some fresh air to your feet by walking barefoot when you are at home. Number 9, alternate your pairs of shoes. You can wear one pair of shoe today, another pair of shoe tomorrow, and another pair of shoe the 2 days later, and so on and so forth. This will allow your shoes to have enough time to dry out between uses. And number 10, avoid prolonged contact of your feet with water. Avoid staying for long in a watery environment. Thank you for having watched this video. Please consider liking and subscribing, and see you soon for another video.